Hello everybody, just want to welcome you to the introduction to the PCREF, which is the Patient Carers Race Equality Framework. It's based upon an anti-racist mechanism to ensure we are addressing race disparity that emerged as far back as 1870 with these comments from Henry Maudsley about eugenics and the black race, which unfortunately has affected historically and contemporary mental health practice and has led to the loss of George Floyd and the amazing response from organisations to really make sure that we have the best mental health outcomes for all communities. To understand the patient and race equality framework is to understand the context, the overrepresentation of racialized communities diagnosed with schizophrenia, more likely to be postally admitted to mental health units and more likely to be strained. Unfortunately, the legacy of the loss of individuals such as Sean Riggs, Alana Lewis, Christopher Clunas has led to a big demand and a shift towards addressing race equality in mental health practices. The pictures are alarming, they're concerning, but it should inspire us and motivate us to work together from patient, carers, nurses, and all staff to really address how we can offer more effective services that are culturally appropriate. As a person with lived experience and a diagnosis of schizophrenia with 4 admissions on 4 different wards, it's crucial we begin to understand very clearly and simply the PCREF is a 3-layered model which we've got to be more flexible. The first thing is governance collecting the relevant data that gives an idea about what is it we should do to address the needs of people on wards. And then the second part is the competencies and the knowledge and awareness, which informs a co-production model. That means how do we work together to improve the way we offer care and support and treatment on the wards. Lastly, the most important aspect is the patient's voice. Through data, through questionnaires, we can get a great idea about how the PCREF can be really effective to address change. In this slide, I just encourage managers and nurses and patients to begin to look at the PCREF in a logical order. What is the patient's voice? What evidence can we collect and how can we use that to make sure the voice is heard continually? How does that voice, that experience then affect the experience of the staff? The skills and competency they need to have, some of the theories that we need to change to make sure it's more culturally relevant and it's influenced the diagnosis, medication and the treatment plans. That's a change in training to really embrace these changes. Those 2 links, the patient and the staff changes, should be supported by the governance, the data they collect, the representation and how they listen to the patient's voice. So where do we go next? An important challenge is beginning to actually get the right data, use that data for very simple outcomes that motivate a greater working between staff and patients and governance, and also to recognise the real importance of Senny's law, the Mental Health Use of Forces Act, how we can align that to the PCREF to offer better services, better outcomes for racialised communities, people with autism and disabilities.